Good afternoon, everyone. Welcome to the Elipse Gastric Balloon live Q&A session. Thank you very much for joining us. Just to let you know that we're having a few technical issues, unfortunately. I am due to have one of our consultant bariatric surgeons join us on the session today. So if I can just give him a minute to join us, hopefully. If not, then we'll start. But just to give you an idea, really, of what we're looking to achieve on the session today. So really, it's about giving you some information on the Elipse Gastric Balloon program to see if it's something or a weight loss solution that you think would work for you. I think Mr. Kasem is trying to join us now. So to give you some information on the Elipse Gastric Balloon, and also to open it up for you to ask any questions that you have. So you'll see sort of top right on your screen, there's a chat section and a questions box. If you have any questions as we go throughout the session, then please just pop them in that questions box and we'll answer them towards the end. So really it's just about going through a little bit of information on what you would hopefully want to know, sort of what the procedure is all about, how the balloon actually works in terms of weight loss, what we as a provider offer in terms of the aftercare, and then obviously any extra questions that you have. So I think Mr. Kasem is joining us now.
Can you hear me okay?
I can. Hello there.
Hi.
Hi, Mr.
Sorry
Kasem.
about that. There's one or two technical issues, I think, on my side, so hopefully it'll run smoothly, but I may freeze halfway through.
No problem. So, Mr. Kasem, I was just sort of explaining about what was going to happen during the session. So I'll make some introductions now that Mr. Kasem is with us. Myself, my name is Julia Baker, and I'm the General Manager of Gastric Balloon Group. We're a national provider of gastric balloon procedures. We offer only the gastric balloon procedure. We're a specialist in gastric balloons only, and we have a nationwide network of clinics across the UK. In terms of, sorry, I can hear myself, Mr. Kasem. Are you able to mute me just for a moment?
Okay then.
Sorry, apologies everyone for technical issues. I think this is new for everybody. We're all getting to grips with this sort of online session, so apologies for any technical issues. You'll have to bear with us a little bit. We're all sort of set at home in not our normal sort of environment, so apologies again if we're having any issues. So sorry, to introduce myself again, Julia Baker from the Gastric Balloon Group. I was just saying that we have a nationwide network of clinics across the UK. And we have in Scotland, Wales and Northern Ireland. So hopefully wherever you are in the UK, we've got a clinic that's not too far away. So joining me today, now that he has joined us, is Mr. Hasan Kasem. He's a consultant bariatric surgeon that does ellipse procedures for us up in Glasgow. And we also have Liz Heppenstall, who you can't see, but is present within the chat, so she can chat with you in that section there. And Liz is one of our patient care coordinators. So Liz would be your point of contact if you called us, for instance, and made an inquiry. And if you went through with a procedure, she'd be your dedicated point of contact. So right the way from that initial call through to us, all the way through to your procedure and beyond, really. And as we go through the session, if you have any sort of extra questions, as I say, put them in the question tab. And Liz can help to answer those for you, and we'll pick them up at the end of the session. Okay, lovely. So let's get started. So if I can pass over to Mr. Kasem to go through some details on the Elipse procedure.
My name is Hasan Kasem, as Julia said. I'm a consultant bariatric surgeon. I work out of the University Hospital in Wishaw in Lanarkshire, and I've been a consultant now for 15 years, and my main speciality is, as I said, based on surgical and endoscopic bariatric procedures. Funnily enough, I'm going to talk about the Elipse balloon, which doesn't involve any endoscopy or surgery. Can you get the next slide, please? And again, please. So when you first come to see me during our consultation, the main things I'll really be wanting to know is your dietary history and also your medical history. And that's really because it kind of gives me an idea of what you're looking to achieve, how we can help you, and also if you're suitable for the procedure. In terms of suitability for the Elipse, basically we're looking for anybody with a BMI greater than 27. You have to be between the ages of 18 and 65, and the major thing we're looking for is to make sure that you've not had any kind of major abdominal surgery. So for most people, there isn't an issue and they are suitable to go ahead. Next slide, please. The procedure itself, as I said, is relatively straightforward. It's about 20 to 30 minutes long. It's a walk-in, walk-out procedure. It doesn't involve any sedation or anesthesia. It does, however, involve this thin capsule, which I hope you can see. It's probably about the size or half the size of your thumb. What we do is get you to swallow it. As you can see, the capsule's attached to a wire. This wire with the capsule then passes down slowly into your stomach over the course of a few minutes. As you can see, there's some markings on the side, and this allows us to kind of gauge where the capsule is and where it's progressed to. Once we think the capsule's in your stomach, we then get you to have an X-ray. I look at the X-ray, check the position, and then start filling the balloon. In the meantime, the capsule in your stomach has dissolved. This allows us to fill up to the balloon to about this size, and it contains about 550 mils of fluid. We then re-X-ray you, check that the balloon's in the right place, and once I'm satisfied it's in the right place, I gently pull at the catheter to release the balloon so it lies nicely within your stomach. After that, it's a matter of just simply walking out, and that's the basic procedure done. Now, the capsule is filled with a special fluid, and it's non-toxic fluid, but it is a specific combination. If you can look, you can see there's a kind of a whitish area around there. That's the valve. On the inside of the valve is a special stitch. The fluid is designed to dissolve that stitch at a specific rate, so that at 4 months' time, the stitch dissolves, the valve opens up, releases all this fluid. The balloon then crumples from this size to this kind of size, and then passes out your system normally. The majority of the patients don't even notice that this has happened. Next slide, please. The purpose of the balloon is mainly to occupy space within your stomach to limit what you can take in by mouth. Now, it kind of turns your stomach into an egg timer. And the idea for us is to keep that top part of that egg timer filled for as long as possible. It won't choose the right foods for you, but it'll help you, give you an idea of portion control. Because we picture of it a bit like an egg timer, if you go onto a shake diet or a smoothie diet, it just doesn't tend to work with the balloon because it tends to slip past. So we're particularly keen that you eat a normal textured diet, but healthy kind of food choices. The other thing the balloon does for you is that it slows how fast your stomach empties, so you tend to feel fuller and more satisfied for longer. However, there is a bit of a catch with this, and the catch is that there's a time delay between your stomach being full and that message hitting your brain. So one of the keys to success of this is really to slow your eating down. And what I always say to patients is to get your smartphone out, set a 30-minute timer, eat slowly over that full 30 minutes, chewing your food well, and as soon as you start feeling full, stop eating. With that, it will help you learn the kind of the normal fullness signals, relearn when you feel satisfied, and hopefully prevent you from overindulging or overeating and help better control your portion sizes. Do you want to carry on, Julia? I think your mic's off, Julia.
Sorry, apologies. So before we move through into the next section, if I can just invite everyone to complete a quick question for us. You'll see by the chat and the questions section, there is a polls tab. And if you wouldn't mind for us just filling in the answer to the poll, just to give us an idea of the kinds of things that might concern you about starting an Elipse program. So if you've never had a gastric balloon before and you're obviously interested in Elipse, what might be the kinds of things that might concern you? And that will just help us to answer some of the questions. You can answer more than one. So if you go to that poll section for us, if there's more than one thing that might make you a little anxious or something that you'd worry about a little bit, if you can just answer that question for us, and we'll give you a moment just to do that. And I think we're having some questions coming through, so thank you very much for that. We'll pick those up towards the end. So we'll just give you just another moment just to fill in that poll, and then we'll carry on with some of the questions that we thought you may well ask, and the questions that we get asked on a daily basis about the programme. And as always, there is no stupid question, so if there is something that is sort of on your mind, please do ask it. We do get asked all sorts, so don't worry. Okay, so let's move on, and we'll pick that up towards the end. So here are some of the frequently asked questions that we will have sort of from inquiries. So if I put that back on, and Mr. Kasem, if you want to carry back on with the slides.
That's right. So a lot of people ask how much they will lose, and on average, over the period of time the balloon's in for, we reckon about 10 to 15 kilograms. So that works out on average about 2 stone roughly. In terms of maintenance, although the balloon's in for 4 months, with the program that we've set out with Julia and the gastric balloon group, studies have suggested somewhere between 70 to 90% of people are able to maintain that weight loss long term. So for me, it gives good long-term weight loss over the period of time. Should we go on to the next question? As I said before, the balloon lasts roughly about 4 months, and it's designed specifically with that fluid and the stitch that dissolves in relation to the fluid. And as I said, the majority of the patients don't even know that the balloon's passed out of the system. Occasionally, some people get a bit of diarrhea and cramping, but that's relatively minimal. Next question. As with all surgical procedures, there is a degree of risk involved. However, the risks tend to be very small, and this is probably the safest of the bariatric or the weight reduction interventions I do, with 98% reporting no adverse events. But I can discuss that in greater detail either at the consultation or in the question sections that we've got. In terms of swallowing, although some people are a bit frightened at the thought and they can say, you know, they have difficulty swallowing capsules, the majority of the patients do manage to swallow. And if you do run into problems, there's specific tricks and techniques we do to make things a lot easier. There's a stiffener wire we can put in, which helps guide the balloon down so that initial swallowing problem isn't a big issue. For us, you know, more than 99% manage the balloon successfully. I don't know if you want to go through the program a bit, Julia.
Yeah, I'll pick this up. So, I mean, really, the gastric balloon is obviously the central part of the whole package of support that we offer. And it's interesting that patients, as Mr. Kasem said, sort of concentrate and focus very much on the procedure itself and whether they'll be able to swallow the balloon, and that's sort of where the focus initially lies. But actually, the procedure itself is a very small part of the whole program. And with the gastric balloon group, we offer a 10-month program. So as you've heard, the balloon is in for about 4 months of that time, and the remaining 6 months very much focuses on the weight maintenance. because I imagine sort of if you've tried diets before, and we know that lots and lots of patients have, you end up on that sort of yo-yo cycle of weight loss, weight regain. And we're trying to really put an end to all of that and to give you sort of the tips, the techniques and the skills to really relearn some lifestyle habits with the help of the balloon being there. So that 10-month program is all about sort of the initial stages and your weight loss in those first few months whilst the balloon is actually in situ. But then 6 months after the balloon has left, has been removed, in terms of sort of really focusing on maintaining those newly learned skills to help you to maintain that weight. And as Mr. Kasem said, with the data that's now being shown, and this was presented quite recently in one of the Illyria masterclasses for the Elipse balloon program, that up to 95% of the weight that is lost in that period is maintained a year after that Elipse placement. So that's really important for you as a patient to know that not only can you achieve sort of good weight loss whilst it's in, but you can also maintain that weight loss once it's removed. And what we do as your provider is give you a whole package of support. And the balloon, as I say, is at the centre of that. So the balloon is there doing its job, as Mr. Kasem has just explained. It's there as your portion control tool. But just like any tool, you know, if you picked up a tool in B&Q, you'd have to read the manual. You'd need to know how to work with it to get the best possible results. And that's really where we come in. So we provide that package of support, which includes nutrition and dietary advice, fitness support, and also some behavioural modification as well. Because we know from dealing with the hundreds of thousands of patients that we've dealt with over the years, it's not about one particular thing, the reason for the weight gain. It's very much usually due to a whole variety of factors. So we're trying to sort of give you that package of support to address each of those to help you get the best possible results. So just to go through the slide that we have here, we have a team of bariatric nurses who, from a medical standpoint, will make sure that you're fit and well after the procedure. And if you're having any of the symptoms that we mentioned before, the nausea and the vomiting for a few days, that they're helping you to manage that and give you whatever advice is necessary. And we'll have sort of scheduled aftercare calls all the way through those 10 months just to check in on you. There's also an out-of-hours helpline as well, just in case you need sort of more emergency access to a nurse, if you ever had any concern about anything. And as I mentioned there, we have sort of a whole module of dietary advice with recipe ideas and meal plans, etc. You have access to an online personal trainer called Baz, who will set you up with an online fitness app. And via that fitness app will set you exercise plans. And he's very good at setting plans that are doable. So it's not sort of that you have to be, you know, a gym bunny to be able to do all of this kind of thing. It's very much set at your level, and you would have that discussion with him. You know, if you are someone that's used the gym regularly, then he will set a plan suitable for you. If you haven't done exercise at all in the last few years, he will set you a plan that's suitable for you as well. And the whole point is just about increasing your activity, obviously in the hope of helping with the weight loss, but also in that sort of maintenance and lifestyle change going forward. And then in addition to that are the habit change modules. And we know that lots of patients will suffer with, particularly at the moment, we're all in quite a weird state of events at the moment. You know, we're all sat at home surrounded by, you know, temptations we wouldn't normally be in. And it's situations like that in dealing with comfort eating, eating out of boredom, you know, all things like that that we all sort of face on our everyday lives. He's trying to help give you tips and techniques to overcome that. And then finally is the SMART scale that every Elipse patient will receive. And you receive this in advance of your procedure. So it gives you a chance to get to know your scale and how it all works. And you connect via Bluetooth with your mobile phone and an app on your phone. So it helps you really easily to track your weight over the period. You can connect up your sort of activity trackers, etc., if you have one of those. And it's a really easy way to keep your weight in check and sort of having that tracker over time. But also for us as your provider, if you send us that information, you can do that really easily via the app. we can see how you're doing. And in addition to the usual calls, if we feel that you need a little bit of extra support, then obviously we can provide that as and when it's needed. So that whole package from us as a support team is here to help you every step of the way. Okay, so really it's a case of we've answered a few questions that we get asked really regularly, but I'm sure there are others that you have that are a little bit more specific to you. So if I move across to the questions section and just see the kinds of things that you've been asking, and then we can answer some of those for you. So somebody was asking about having the balloon in place during pregnancy. There's a very simple answer to that, in that you cannot have a gastric balloon whilst pregnant. So we would say if you were planning a pregnancy, that you don't have a gastric balloon. But having said that, losing weight does have a very positive impact on fertility. So if you are planning on conceiving, then probably the advice would be to have your gastric balloon first and make sure that you didn't fall pregnant during the balloon implantation. And then once the balloon has been removed, then hopefully your chances of conceiving would be higher. So the answer to your question, Laura, would be yes, if you did fall pregnant, you would need to have the balloon removed. So it would be a case of being extra careful during that period, not to make sure that you didn't conceive. Just going through the rest of the questions, bear with me. There's a question here on C-sections and whether they count towards abdominal surgery, and whether you could have a balloon. If Mr. Kasem, if you want to answer that one.
No problem. C-sections don't really count as major abdominal surgery, especially if you have the modern approach where the scar is really straight across your tummy at the lower part, not up and down. So as long as you've got a small incision just above your bikini line, that should be fine.
And just another question here from Mary on having thyroid issues, if you wouldn't mind answering that, Mr. Kasem.
Thyroid issues, again, aren't a problem or a contraindication to having a balloon. There's no contraindication.
I think Valerie asked the question about the kind of results that you can expect to see. And if I just take you back to the slide, Valerie, I mean, hopefully your question has been answered, but just to go over again for you. These are obviously the average weights that we, or the studies have shown with the Elipse balloon. So somewhere between sort of 10 to 15 kilograms or 10 to 15% of your total body weight. Obviously, everybody is different at the end of the day, and we can never guarantee a particular weight loss. All I will say is that, you know, it very much depends on your starting weight and also your commitment to make some changes as well. I mean, I laid out sort of some of the changes that we will try and support you with whilst you have the balloon in place. And the more you take on board and the more you work with us as a provider in making those lasting changes, the better your results will be. So, I mean, we have had patients, you know, lose considerably more than those averages that you're looking at there. But obviously the studies show that they are the averages, so they're the results that we publish. But, you know, your personal result is very difficult to predict. But if you work with us and you follow the guidance that we set out, and you work with us on making those dietary and those exercise changes, then there's no reason why you shouldn't be successful with the Elipse balloon. I hope that answers your question, Valerie. Just moving on to some other questions. We've got lots. Thank you for asking all of these. Jean has asked a question about having a second balloon putting in. So, Mr. Kasem, if I can pass it to you.
No problem. Second balloons are possible because there is a degree of adaptation that the body goes through. Once you've had your first balloon, even though it dissolves or goes away after 4 months, what we would say to you is allow a 2-month grace period just for your stomach to kind of not really go back to normal, because the stomach doesn't really change shape, but really for your body to get readapted to the stomach being empty again. We would then place the second balloon. Now, weight loss with the second balloon is not quite as much as with the first balloon. It's 3/4. It's still about 78 kilograms, which is about a stone and a half. So it's still a reasonable amount. And certainly for some people who are not keen at the idea of invasive surgery, that kind of weight loss with consecutive balloons over a kind of a year period makes a lot of sense to them and works quite successfully for them.
Lovely, thank you for that. Annie Rose has asked a question about really sort of the difficulty in swallowing the pill, and whether it's sort of a phobia of sickness, really, and about the string being attached and whether that causes patients any problem. If you wouldn't mind sort of picking that one up as well.
The swallowing, I know a lot of people have a fear of the swallowing, and sometimes when they see the capsule, they think it's a lot bigger. It isn't actually that much bigger, really. And the way it's designed is shaped to go down easier. As I said, there is a way to, if you have got swallowing problems, to make the wire a bit stiffer, put a wire through the middle of the capsule, and this allows me to more direct and make the swallowing easier. The string is very thin, and most people don't notice it and don't have an issue with it. With the nausea and vomiting, I have to be honest, to some extent, majority of people will get that within the first couple of days. We will give you plenty of medicines to counteract that. It's just a process that the body has to go through because it's got this foreign object, but it doesn't last too long and tends to disappear quite quickly. And again, the majority of patients manage it quite well.
Thank you. Just to pick up on that point, actually, because I mean, we offer a variety of different gastric balloon procedures, and the Elipse is very new in this sense, in that the sort of the casing of the balloon itself is a lot thinner than it is with other gastric balloons. So you may have read, if you've been doing some research online, about the symptoms after gastric balloons. What we're finding with our patients is that the symptoms aren't as bad with Elipse patients, because it seems that the body is able to tolerate the balloon with that sort of thinner casing a lot easier than they are the silicone balloons of other sort of styles. So although, yes, we always have to prepare patients for a period of sort of 3 to 4 days, usually, of adapting and with sort of some sickness and nausea. Anecdotally, we are finding that patients are finding it easier with an Elipse balloon than they are with some of the others. But really, I mean, you do need to prepare yourself probably to take a couple of days off work. You aren't going to feel at your best, most definitely. So taking a couple of days off work is probably the right thing to do, just to give yourself time to adjust to having that balloon in place. And yes, to prepare yourself for a couple of days of nausea, some vomiting, and probably some stomach cramps as well. And that's all the body's natural reaction of trying to get rid of a foreign object, which of course can't go anywhere, but it's the body's natural reaction to it being in place. And another question actually that's come in from Jean, which we were very much expecting in the situation that we're in right now, which is how the current events, obviously with COVID-19, how that's impacting on procedures taking place. I mean, the honest answer, of course, is that in the last 7 weeks during lockdown, we've not been able to undergo any procedures at all, and quite rightly, everyone has been staying at home. The message, of course, is changing a little on that now. I mean, after Boris's speech on Sunday, you know, we feel that things are starting to ease a little bit, but we're still not out of that period. So at the moment, no, we aren't able to undergo any procedures. But as the Elipse is not surgery, it doesn't involve any endoscopy. It's done just in a clinical appointment room and done then under X-ray. It's a much less invasive procedure than the other kinds of balloons that are available, and obviously weight loss surgery. So there is a very high chance that Elipse procedures will be available before any of the other procedures. But obviously, we will only do that when it's safe to do so. So once all of the hospitals have their procedures in place and are able to accommodate procedures like this, then we will start to be able to offer them. But at the moment, unfortunately, we have no date as yet as to when that's likely to be. But we're hopeful sort of over the next month or so that we'll be able to start resuming something. But time will tell, I suppose. What I will say, and Mr. Kasem can probably add some extra information to this as well, he works in the NHS as well, is that the hospitals and the clinics that we are dealing with have not been dealing with COVID-19 patients. So it's not that you will be going in, even if we could do a procedure tomorrow, it would be in a clinical setting that has not been dealing with COVID patients. So they will put the normal precautions in place. The consultants, will be, when we start doing it, wearing PPE. You will be wearing a mask as well, removing it obviously during the procedure itself, but all of the sensible precautions will be in place to make sure that you're safe during your procedure. Mr. Kasem, is there anything else that you wanted to add?
No, I think you've covered the points quite well. As Julia said, where we carry out the procedure, it's what we call a cold site. So it doesn't have an emergency department. It's not seeing emergency cases. So it's not really seeing any kind of COVID cases. Those certainly within Scotland have been limited to NHS hospitals with A&E. We tend to work out of BMI Ross Hall in Glasgow, and that really just deals with elective or planned surgery, by and which large the COVID pandemic, apart from stopping that kind of surgery, hasn't really touched. And the hospital itself hasn't been dealing with that kind of patient.
I think someone else had asked about having some excess skin and whether that would impact being able to have a gastric balloon procedure at all.
No, yeah, it was, who was it? It was Dawn. Dawn had asked that. The C-section and the skin itself wouldn't impact, wouldn't be a contraindication.
I think probably the final question, unless there are any others still to come in, is from Nico in terms of the locations that are available. I mean, as I said at the start, we're a nationwide provider, so we have clinics across the UK. And we're having a growing number of locations. It's probably easier, Nico, if we get in contact with you, probably all of you actually that have been sort of attending the seminar or the webinar, sorry, and sort of get in contact with you, find out where you are, and then put you in sort of in contact with the nearest clinic. We do have clinics throughout England, covering most of England, and then in Scotland, in Glasgow, in Wales, South Wales, which is in Newport, and then in Northern Ireland, just outside of Belfast. But following this webinar, we'll be in contact, and then we can get some extra information from you and give you an idea of where's your nearest clinic. Okay, so I think that's answering all of the. Oh no, sorry, Jean's just put in a question. Is there a base in London? I mean, yes, actually, probably London is our most covered location. So there are a number of clinics that we have around the London area. So again, Jean, we can be in contact with you and find out which might be your closest location. Okay, so unless there are any other questions to come in, I suppose the next thing to do is, following this webinar, we can send you a copy of the recording, just so that if you needed to, and if there was anything that you sort of heard today that you want to go back over, we can send you a recording of the webinar that you can listen to in your own time. And then we'll follow up with you, as I just said, just to see if there's any extra information that you'd like. We'll send everybody over a full quote, which will include any finance options, just in case anyone might like to spread the cost of the procedure. There are a number of finance options that we have. So we'll send everybody some information across on that as well. And obviously, if there are any questions that you didn't want to ask during this session that you wanted to ask sort of off in a more private setting, then obviously we can take those as well. So the number will be that you can contact us on, and the email address, etc., will be on the final slide. So if you want to get in touch with us through any of those means as well, then obviously we'd be delighted to hear from you. Anything else to add from you, Mr. Kasem, before we wrap up?
No, just thank you all for attending. And really, I know often taking the first step is often the hardest, but thank you all for coming and taking that first step.
Lovely, thank you very much. And a very big thank you, as Mr. Kasem has said, to all of those that have joined us today. And as I say, if you want to follow up in giving us a call, we're a very friendly bunch. So, if you want to just give us a call and have a chat and find out if it is something that you think could work for you, we're happy to discuss if there's any sort of particular questions that you have. Right, well, thank you very much. And we'll hopefully speak to you soon. Thanks very much.